Welcome back. This week you heard tuberculosis being mentioned in the news because Metro Health confirmed that a student at Brandeis High School in the Northside Independent School District had it. Now that student, we're told, is off campus and in stable condition.
Yeah, but that incident got us thinking about TB and how we treat it. Joining us for this conversation today, Dr. Larry Schlesinger, the president and CEO of Texas Biomed, and a senior physician in the field of tuberculosis and a principal investigator at the National TB Training Center. Dr. Schlesinger, always appreciate you joining us for these segments. We like to separate fact from fiction when it comes to this. What are some of the biggest misnomers or myths when it comes to tuberculosis, something that you've spent so much of your career studying?
Well, I think the first thing I would say is people often think this is something from history books and that we don't have tuberculosis today. The other is it's over there and it's not here in this country. Those are myths. Texas has a large number of cases, second only to California. And Bexar County is also the third highest caseload in the state of Texas. So it is here in our communities and it's difficult to diagnose.
Okay, so let's go back and talk about what tuberculosis actually is. What are the symptoms?
Well, tuberculosis is a bacterial infection, which most commonly presents as a pneumonia. And we call it an atypical pneumonia because it kind of smolders for a while, perhaps 1 to 3 months. And it's often misdiagnosed as just a community pneumonia. People can have significant weight loss, they can have fever, and on rare occasions when they cough up sputum, it can be so-called blood streaked, a little bit of blood in the sputum, but it's mostly a pneumonia.
What immediately came to your mind when you heard about the student that contracted tuberculosis?
Well, I just, it's another reminder. This is a student who probably was coughing, had pneumonia. I don't know the case specifically. And yet maybe it was chalked up to COVID or another viral infection. And no one perhaps thought about tuberculosis right away. This is commonly the case. And then finally it was diagnosed. And then it's a matter of finding out who's been exposed.
So obviously a lot of people are thinking about COVID, right? Yeah. When you start coughing, now people even think, before they even think it's the flu, they think automatically it's COVID because we've been talking about it so much over the years. What do you think? So can we just talk about the differences between TB, COVID, the flu, other things? What differentiates this, and also from long COVID?
Yes, COVID, influenza, they are viral infections due to viruses, and those are acute infections. The virus gets in you and you get sick pretty quickly. The incubation period's relatively short. You get sick, over a period of a couple of days. Tuberculosis, when you inhale the bacteria, actually the most common scenario is you inhale the bacteria and you stay healthy. Most people who inhale tuberculosis bacteria stay healthy, and the way you know it is your skin test has converted. But if you are sick with tuberculosis, either by just acquiring the bacteria or reactivating it from inside your body, it can smolder for a period of weeks to months as you lose weight and have fever before it's diagnosed. So it moves more slowly, and it's a bacteria, not a virus.
When people are infected, how long does it take them to recover usually, and what's the treatment like?
Well, this is a real problem because this is a bacteria that's very hard to treat, and we have more and more drug resistance. If you're fortunate in a way to have bacteria that are susceptible to our current antibiotics, it's still 4 drugs for 2 months, followed by 2 drugs for at least 4 months. So 6 months of therapy, and there's some toxicity. This is difficult to treat. And the growing rise in drug resistance is a real problem because if you're diagnosed with resistant bacteria, you could be on treatment for over 2 years. So it's very different than treating an acute viral infection.
And how does this work vis-a-vis isolation during that time? Because at that same time, while one person's infected, you do want to protect other people as well.
Right. Once you're diagnosed with active pneumonia, where you could be coughing out the bacteria, you actually have to, as this patient, I understand, had to get away from other people, go home and be treated, and stay in isolation until they're considered non-infectious. There's pretty standard ways of stating someone's non-infection. There are three things basically. The first is that the person collects sputa, usually in the morning, and has to have 3 consecutive negative sputums for the bacteria. That they're on therapy, usually for at least 2 weeks, and that their clinical symptoms, the fever, the weight loss has stabilized, the cough is decreasing, perhaps the fever is gone. Then someone, if they have susceptible bacteria, can go back in the community. If not, they need to stay in isolation.
Obviously, I'm making some assumptions here, but you think of a high school student, you think of someone who's probably fairly healthy, certainly young. Are there who are people that are most at risk for getting serious TB symptoms, or are there does it just not, delineate that way?
Right. This is important because, as indicated by this case, healthy people can get tuberculosis. And this is usually a case where someone's in close proximity to someone who has active tuberculosis and is coughing out the bacteria. It's usually you have to be in close proximity of someone for a bit of time, a few hours each day, something like this. But even healthy people can get tuberculosis. But there are risk factors. Diabetes is a big one, HIV, cancer, homelessness. These individuals are at particular risk of tuberculosis, so we know what those targeted groups are. But the key, even healthy people, if in the right setting, congregate setting, closed, no ventilation, can get TB.
All right. And Doc, just final question, is a mask enough to protect you?
So a particular type of mask, in this case, people know now the N95, the respiratory mask, is the only way to really protect you. And if you're in those risk groups, to understand that it's around, needs to be treated. And right now it is treatment. The vaccine is available, but in adults, it's really not that effective. So researchers like myself are focused, and at Texas Biomed are focused on developing new therapies and vaccines, easier to tolerate therapies, and better vaccines.
All right, Doc, thank you so much for joining us today and answering our questions.
Yeah, always appreciate you lending your expertise to us. Dr. Larry Schlesinger from Texas Biomed. You too. Take care.
Bye-bye.
And we'll be right back after this. Keep up to date with all of San Antonio's top news, weather, and so much more by clicking the like and subscribe buttons below. And once again, thanks for watching KSAT.